So, good evening to all of you, and I welcome you all for this meeting, which is on bone health in solid tumors. And as all of you, next slide, please. As all of you are aware, bone metastases are common in patients with advanced solid tumors, and as you must be all aware, it is very common in breast cancer, prostate cancer. That is around 5 to 75% of patients will develop this kind of complications at a later point of time. And it's also common in lung cancer and thyroid cancers, besides all the other malignancies. But the commonest are breast and prostate, followed by lung and thyroid. Next, please. And these bone metastases lead to skeletal-related events, which are in form of either bone pains or pathological fractures. And subsequently, what happens that if the patient develops pathological fractures, they will require surgical intervention. Sometimes the patient do develop spinal cord compression, that again requires either surgical intervention or radiation therapy. So, important means of treating these diseases, skeletal-related events, could be radiotherapy or chemotherapy, hormone therapy, and the surgical intervention in form of anything. But besides that, two of the latest developments that have taken place are the development of bone-directed therapies, which are holding important place in the present day scenario. Next, please. As the pathological fracture is quite common in breast cancer, and the SREs in prostate and lung cancer are in the form of bone pains, and subsequently in the form of bone metastasis. Next, please. As the life expectancy goes up, the chances of survival improve, the chances of development of multiple skeletal-related events do increase. So, as the patients are living longer, the patient with breast cancer, prostate cancer, a higher degree of them develop bone metastasis. Next, please. And the frequencies of SREs in patients with breast cancer is around around 64%, and the prostate cancer it is around 44%, and same in case of lung cancer. So, if you see all the solid tumors, especially breast, prostate, and lung, their chances of developing skeletal metastases are very, very high. Next, please. And this shows that prior SRE increases the risk of subsequent SREs. So once somebody develops a skeletal-related events, the chances of the other events are also going to be high. Next, please. So why SREs are important? Because there is a lot of substantial burden to the patient and the healthcare system. The direct consequences to the patient is pain, pathological factors, and sometimes spinal cord compression, and it may also require surgery for the bone. Indirect consequences to the patient are poorer physical function, emotional distress, reduced quality of life, and multiple hospital visits and stays. And healthcare resources utilization has increased treatment costs and increased hospital visits and stays. But the things have really changed in the last decade or 2 decades, you can say, with the advent of zoledronic acid and this thing we have agents which are available for taking care of skeletal related events. Next, please. Next. And so today's agenda, we have we will mainly discussing about skeletal related events, and I would invite now the chairpersons, Dr. Meenu Walia and Dr. Sameer Khatri, to take the things forward, and subsequently we will be having the lectures by Dr. Amish and Dr. Jyoti Wadhwa, and followed by a clinical case discussion on bone health and prostate cancer by the panel moderator by Dr. Vineet Talwar. So let me invite Dr. Meenu Walia and Dr. Sameer Khatri. Next, please. Dr. Sameer Khatri, please.